Good morning, everybody. I'm Dr. Annapoorna Kini, Director of Cardiac Catheterization Laboratory, as well as the Interventional Director for Structural Heart Program at Mount Sinai Hospital. Today, for the New York Symposium, I'll be discussing coronary access post-TAVR and what is the update that we have with the TAVRCathAID, the new web app, as well as the phone app that will be released today. So coronary artery disease before and after TAVR, if you see here, the incidence of coronary artery prevalence based on various trials can vary anywhere from 20% to 80% CAD. This is existent in patients with aortic stenosis. Also, management of CAD after TAVR has, there are a few reports to say the access could be difficult based on the valve that we have been using. So what did this study show? The risk adjusted at 30 days for all-cause mortality in patients with TAVI and PCI versus who got TAVI alone. What you see here is even if they had CAD, what patients who had TAVI alone actually did better compared to patients we had TAVI plus PCI. 1 year all-cause mortality also showed that patients who had concomitant CAD but only had TAVI did better compared to patients who had TAVI plus PCI. So the meta-analysis actually concluded saying that PCI with TAVI in patients with severe aortic stenosis and concomitant CAD grants no additional clinical advantage in terms of patient with clinical outcome. So further randomized trial needs to be done to see whether these patients' coronary artery disease has to be managed before or after. The ongoing trial, the study design of the complete TAVR is that patients who are with aortic stenosis who have more than one vessel disease of vessel more than 2.5 millimeter in diameter and 70% visual angiographic stenosis will undergo TAVR, but will have a randomization of revascularization. You see here post-TAVR versus those patients will be managed medically, guided medical therapy. All of them will be on good medical therapy based on what treatment they get, and there will be a 3-year follow-up looking essentially for death, MI, and ischemia-driven revascularization in these patients. Also, couple of trials which have shown that a re-access after the SAPIEN valve, if you see here, re-access, a small study, was successful about 100% of the patients, but PCI success was about 97% of these patients. So what is the, after TAVR, what is the presentation of this patient? Majority of them stable CAD, and some of them do present with unstable symptoms. This is another study where all available TAVR valves were used. And if you see here, 7.7% unsuccessful cannulation after TAVR compared to before TAVR, if you see here. And what important thing is the left coronary cannulation after TAVR usually is very difficult. So this is before TAVR. After TAVR, multiple catheters are being used to cannulate the left coronary artery. Right coronary artery is usually okay. You are able to easily cannulate. And what did the multivariate predictor for unsuccessful coronary cannulation was that TAVR valve with the sinus of valsalva relationship, the depth of the implant, and of course the use of evolute valve. Odds ratio was close to 2.6% in this study. So we were the first one actually who put out this review article saying what are the important factors for include patients who are undergoing TAVR. This was the central figure showing there are anatomical factors as well as the device and procedural factors. Anatomical factors are the sinotubular junction dimension, the sinus height, then we have the leaflet, how bulky it is, and the length of the leaflet, sinus of valsalva width, as well as the coronary height. which is very important for consideration. And device and procedural is where is a commissural tab placed, the sealing of the skirt, as well as the valve depth. Everything has to be taken into consideration so for reaccess. So in the same paper, we also said that, how do we make sure that we are able to cannulate the coronary artery? So all depends. If the commissural post is away, it is much easier. And what we also found that based on our experience that the catheter size usually is smaller, because now you have the metallic valve that is sitting in front of the left main and RCA. So a smaller size catheter, which is FL. If not, quickly go to the Akari guide. And then I'm going to show you some animation, how actually so many times you're not able to cannulate, but you can place the guide at the ostium and then, able to wire through one of the diamond, use balloon support, use guide extension catheter to access and subsequently do the procedure. If the commissural post is in the front, then it's harder, but the animation will tell you how to get it across. So for the balloon expandable valve, same, if the commissural post is away, you can use any standard catheters. If the commissural post in the front, you just have to be again cautious, but still will be able to get it with the smaller, but any of the regular catheters that you have been using to engage the left or the right coronary artery. So the TAVRCathAID, what we did is we, is the second version of the TAVRCathAID that has come up now. We have made a web version, and this app is free for download. And let me go over what are the important features in the newer TAVRCathAID. The important features are added case reviews. So 8 detailed case reviews show how coronary access was achieved in patients. So guide catheter escalation when it's required, guide extension catheter use, as well as proceeding for diagnostic catheter to intervention, how we did it. All these cases have been discussed in this new app as well as in the web app. Most important is offline functionality. No matter where you are, shielded cath lab, whether you're on an airplane, underwater tunnel, where there is no internet access, you will never get this try again. You'll be able to, go through this app as well as the case reviews, whatever you want to do offline. And a beautiful updated user interface, which is very easy to browse and understand exactly what you want to do and where you want to do. And important is a powerful search function. Application-wide search function has been introduced that will find that it will take you right where you want to, and will be able to get the cases or any kind of things that you're looking for. What is the catheter you need to use? This kind of a powerful search function has been included. And more important is 8 detailed animation of exactly how you can engage this coronary arteries. And this is whether it is a diagnostic catheter or whether it is a PCI. You see here, you just click the button, it will take you whether you want to go to coronary artery or PCI. And then you see here, we will have that animation subtitle before how it works. So left coronary engagement, this is the bird's eye view, how exactly, you have to manipulate the catheter clockwise, anti-clockwise. So you will be able to enter the diamond. So in this particular procedure, you see here, in the commissural post is in front. So you have to move the guide anti-clockwise. So we'll be able to get into a diamond either below or above. And then you get your guide through the diamond slightly into the sinus. And then you will have your coronary wire to engage the coronary artery. This is the full animation that is showing how you can engage. So you see here, the catheter size is smaller. Since you have this wide cage that is now sitting in the aorta, so this curve will be smaller. and you see this post is right in front. So what we did, you see that you have to rotate the catheter clock, anti-clock. So you're now below the diamond. And once you're entered the diamond, many times you're not able to advance and engage the coronary artery. That's okay. So when you are right in front, then you will wire. It'll go further down the wire. And then what you did was with the balloon support, you dilated the lesion. And once you're dilating the lesion, your guide extension will come into the left main, and just be cautious not to cover the circumflex. Just stay in the left main. You did the PCI with the balloon, then you place a stent and you then come out. Now there are cases where use 7 French, guide, and even we have performed rotational atherectomy. So there is also a new web app that we have. This is the website. This is the new website that we have created, which shows everything very easy, which is the basics, where you know all the basics and discussion of each and everything, the toolbox, valve engagement, applied anatomy, everything, as well as the animation. Also, what we have created, this animation will be free for download. So you guys can download and use it for educational purposes wherever you want. So the web app available on www.cardiologyapps.com, and then you go to TAVRCathAID. So thank you for your attention, and we're ready for any questions you have regarding this TAVR reaccess.